Good. Well, good morning. We have a fair bit to cover today, so I'm going to start with what is going to be the key over the next few days. I'm going to remind people that if you have any symptoms whatsoever, please go and get tested. Make sure you are checking our Queensland COVID website for any exposure sites. Make sure you're checking in when you go to venues and, of course, come out and get vaccinated. Now, I can report today that we have 7 new cases. 2 are overseas acquired and are in hotel quarantine. 2 are interstate acquired and 3 are locally acquired. Of the 7 new cases, 4 of those have been infectious in the community for a period of time. We have the Gold Coast case, which we have a new couple from the Gold Coast who have been infectious in the community to up to 13 days. One of those people work at a private aged care facility. We can report all of the staff are fully vaccinated and over 90% of the residents are fully vaccinated, and we are testing everyone in the centre today, and we are not moving anyone from that site at this point. We reported yesterday afternoon that there was a case in Capalaba. This case is someone who had travelled to Greater Adelaide, attended the school reunion that has shown a super spreader event, and now we can report that their close contact has come back positive this morning as well. We have, of course, another one who's in hotel quarantine who has travelled from interstate who is unvaccinated because they are a child. We do also have, that brings us to 30 active cases. We've had 10,184 tests in the last 24 hours and 10,573 vaccinations. That brings us to 87.03% first dose and 77.7% second dose. So that's great. We're seeing those second doses moving quicker because of the surge we have had in the take-up of first vaccinations in recent times. And I can report we've now got 7,189 people who are home quarantining who have come from hotspots and have been able to come since we hit that 70% double dose. So I thank all those people for doing the right thing in home quarantine and working with us to make sure that we keep everyone safe. There is one other issue before I move on to South Australia as well. One of our overseas arrivals had travelled from South Africa and we had been doing genomic sequencing on this person. The Public Health Unit have ruled out that it's Delta. But we haven't been able to confirm it's Omicron. It is being treated as that, but it is not known what type of variant it is, and I'll have Dr. Peter Aitken talk about that one a little bit more detail. I do want to say that seeing we've had cases in Capalaba now where we still don't know, there will be community transmission, which we've seen. We also know that there will be exposure sites. So anyone in the Redlands LGA area, please come out and get tested if you have any symptoms whatsoever. I can say Redland LGA has 92% first dose vaccinated, so well done, and 83.2% second. And of course, same message for people on the Gold Coast. We still don't know where the original source is. The 2 people that we're reporting on today, it appears could be the source of the other person's infection because they have been at a meeting together. However, we still don't know where this couple have acquired it from. So we're still seeking the source, which means there still could be more community transmission on the Gold Coast. And the Gold Coast still only has 83% first dose and 73.8% second. So I also want to give a shout out to all of our health and emergency services, particularly who have been working out at Gundawindi and working with us at Toowoomba and Warwick to deal with issues out there. And I'll have the Police Minister give an update on the floods shortly. I do want to talk about South Australia. So due to the outbreaks that we've seen in South Australia and the many exposure sites that have been listed, we are declaring Greater Adelaide as a hotspot from 1 a.m. tomorrow morning, 5 December. This follows, of course, the many cases that have been connected to the school reunion in Adelaide, which has now seen 2 positive cases here in Queensland and multiple high-risk exposures. So anyone who has been in Greater Adelaide since 1 a.m. on the 28th of November, who arrives in Queensland after 1 a.m. tomorrow, will be required to go into 14 days mandatory home or hotel quarantine. They are required to be fully vaccinated, but if they arrive after 1 a.m. tomorrow and before 1 a.m. Saturday, we don't require them to have a negative PCR test. What we do require is them to get a test as soon as they possibly can once they arrive here. But anyone arriving after 1 a.m. Monday the 6th of December, you will need to receive a negative COVID PCR test result in the 72 hours prior to arrival, as well as being fully vaccinated. For those who arrive into Queensland prior to 1 a.m. tomorrow, as I say, they don't need a PCR test till they get here. Anyone who is already here or arrives before 1 a.m. tomorrow morning will be required to get tested and isolate at home until they have a negative result. Now, the Greater Adelaide area covers around 20 LGAs and also the unincorporated area of Torrens Island. So please, if you have travelled anywhere in South Australia since the 28th of November, we ask you to check our website and have a look at those hotspot areas, and also if you are planning to travel down there, or if you are down there and seeking to come to Queensland in the next few days, you need to look at our restrictions that are in place. So I remind everyone, check our website for exposure sites, go get tested if you have any symptoms, check in at all the venues because we know how important that is to be able to contact, trace and isolate as quickly as possible for any positive cases, and go get vaccinated. There'll be testing sites, of course, in these areas, in the Redlands areas and also Gold Coast. There are plenty of places to come out today and tomorrow and get vaccinated. We call on you to do that as soon as possible. Now, ask Dr. Aitken to just talk a bit more about those cases. Then we'll take questions on COVID and the South Australian restrictions before I hand over to the Police and Fire and Emergency Minister. Thank you.
Thanks, Minister. And as you've heard, 7 new cases today. And this is probably just something to think about as we're moving forward. As our borders open, we are going to see more cases come through. So it's really important that people remember that, really important that people go out and get vaccinated, because the most important thing is that vaccination will stop people getting sick. Vaccination may not necessarily stop people getting COVID, and we know that, but that's not what the vaccination is designed to do. We know from New South Wales, from Victoria, from elsewhere in the world, that vaccination has an incredibly effective role in preventing people getting severe illness, incredibly effective role in stopping people needing to go to ICU or dying. And that's why we're asking people to get vaccinated. The 7 cases we've had, there's 2 at the Gold Coast. They're husband and wife. The husband has predated symptoms before the previous case we've talked about at Gold Coast. We're still following his movements to see where he may have been exposed, but there is an epidemiological link to the previous case at Gold Coast, so we're expecting that will be the link, but we're waiting for genomics to confirm that. His wife works at a nursing home at the Gold Coast. She's fully vaccinated, but she hasn't worked there. We're following that through. The nursing home has been incredibly good to work with, and just note that they've got 100% of their staff vaccinated, which is wonderful, and over 90% of their residents vaccinated as well. All those residents and all those staff are being tested again today to be sure, and they're all staying in place. They've got a wonderful setup there, and we're quite confident we'll work through that very, very well with the Public Health Unit. We're also working through all the other venues that they've visited, and they'll go up on the website, so please just watch those. And if you have been at any of those, please come forward and get tested. The other cases of note is the woman at Capalaba who has visited the South Australia. She's done nothing wrong. South Australia is open for business. She's gone down there, and I hope she's had a great time. But what we're worried about with South Australia is that there's a number of cases linked, and what South Australia, as they've done more contact tracing, have identified an increasing number of venues of concern, and that's what we're worried about there, that those people that have then been exposed to those other venues will travel and come back to Queensland. She's fully vaccinated. She has been tested and is positive, and her partner has also tested and is positive as well. The other cases, a child who's a member of a family group that already has positive cases in hotel quarantine, and 2 interstate or overseas arrivals. Both those have come from PNG, but separately. One on day 1, one on day 5, both fully vaccinated, and they're in hotel quarantine with no risk of infection to the community. Look, I'll go back and I'll say it again. I think the really important thing here is this is what we're going to start seeing. So it's so important that people have symptoms to come forward and get tested, and it's even more important to come forward and get vaccinated if you haven't already. There's been an amazing increase in the last 2 days. We've had a 0.9% increase in second doses. We want to see it go further. We want to see it go higher. We want to hit 80%, and we want it to go beyond that, because the further beyond 80% we go, the more Queenslanders are protected from COVID, as it will inevitably come into the community. So thank you, and again, please get vaccinated.
Minister, you've been warning about this for a long time. Is this the start? Has the horse bolted now for people who are unvaccinated?
I think we should prepare ourselves that we said when our borders open that we will see the virus coming into our community. Now, what we're seeing is because South Australia has opened its borders up to hotspots, that people are going into those communities in South Australia with the virus and consequently infecting other people who have every right to travel to South Australia and to come back here and are eligible to do so, but it has meant that the virus has come here earlier than we hoped. But you know, we should prepare for this. This is exactly what's going to happen when our borders open in a matter of days. We know that no later than the 17th of December, the borders will open up to New South Wales, to Victoria, and now to Greater Adelaide, who will have to be fully vaccinated and have a negative PCR test once we hit that 80% while we declare a hotspot. So yes, everyone should be prepared, and what we do know is whether it's Delta, whether it's Omicron, the fact is that vaccinations appear on all of the evidence to be safer and to, certainly reduce the risk of someone ending up seriously ill. So please go and get vaccinated. We are so close to those borders opening, and we're seeing it's transmitting through other states now anyway. So, yep.
Can you confirm that we are still going to be reopening on schedule? There will be absolutely no changes?
Well, the Premier has said there is no change to our roadmap at this stage. We're not predicting what date we're hitting the 80% mark. The Premier said yesterday that we would be waiting to see what our vaccination rates are like over the next couple of days, over the weekend. So Monday we'll have a better idea of when we think we're going to hit that 80% mark. But also the Premier talked about National Cabinet on Friday and getting an update on what we do know from Omicron. But at this stage, there's no change to our plan.
Minister, just on that, the Premier said yesterday, National Cabinet will be able to update the public a fair bit more on what's going on, especially around this Omicron threat. Given the numbers and how good they are at the moment, I'm no genius, but I think we'll probably hit that 80 by about Wednesday. Does that mean, being the Health Minister, you'll probably be advising with the Premier that you may have to put off the opening of the border until you get to National Cabinet on the Friday? It might be a 2-day stall.
Look, we don't know yet. The Premier said the plan's still on track, but let's wait till Monday, see what our vaccination rates look like. We did have a bit of a plateau there, but the last 3 days has seen our vaccination rates coming back up again, I suspect because of the new variant. So we're not going to make any predictions other than our plan's on track at the moment. Let's see where our vaccination rates are on Monday. We're working really hard with the police as to when that border does change. We'll have a new border pass that people will need. We will have, to manage all of the traffic that is going to pour over our border at the coast. And my message to the people on the Gold Coast, caravans, cars, trucks, you name it, there's thousands of them coming in a matter of days. The vaccination rate isn't as high as it should be, and we've got cases on the Gold Coast. Please come out and get vaccinated.
So it's pretty safe to say that this is Omicron in hotel quarantine. I know it's early, but if it's not Delta,
So it's been referred to, so that it's already on the radar of the international experts who determine what the variant is, because it has some of the signs of Omicron, but not all of them. So it'll be in their hands now to determine what this variant is, but it's not Delta.
Blessing in disguise that we caught it in hotel quarantine.
Oh, absolutely. Absolutely, but we are seeing community transmission of Omicron in New South Wales. States like South Australia are open to New South Wales and Victoria. We're going to be open to New South Wales and Victoria in a matter of days. Omicron and Delta is going to come into this state. There's no question about that. It's just how quickly. And that,
Will there be a lag once we hit that 80% in terms of?
as I say, we'll have more to say on Monday. Yeah. Yeah, so we're working with that with police and the logistics of that, but we'll have more to say of when we think we're going to hit that 80%, what that transition's going to look like once we see the vaccination rates over the weekend, and also hopefully getting more information. Premier didn't say we have to wait till Friday, but she has said wait and see what everything looks like on Monday, and we'll have more to say then.
Are we dusting off the masks, Minister?
Anything's possible. We have to prepare for all of that. We know masks work. We know masks have been extremely successful. We know summer in Queensland is uncomfortable at the best of times. We love our summer, but wearing a mask is not going to be a pleasant experience. But there's one thing Queenslanders can do to try to reduce the restrictions that we'll have to put in place when there's outbreaks. That is get vaccinated. More people that are vaccinated, the less restrictions we'll need.
Minister, is it
Sorry. Sorry? Well, as of yesterday morning, we just had the immediate cluster of the school reunion, and there hadn't been any exposure sites listed. So, it wasn't appropriate yesterday morning to declare it a hotspot because at that stage it appeared to be contained to just the people who had attended there. Now there is a very long list, as I understand, schools, hospitals, churches, right through Greater Adelaide, and we've also had a case already appear in Queensland, now 2 cases linked to Greater Adelaide. So there's no doubt now is the time. We're giving people a little bit of leeway. It kicks in at 1 a.m. tomorrow morning. But of course, anyone who's already here, who's travelled to Greater Adelaide, should already be getting tested. After you hear this message, go get tested and isolate till you get that negative result. Sorry.
Is there going to be anything different happening for that game?
Sorry, which?
We've got the Ashes coming up.
There's no changes at this stage, no.
Minister, is the government considering enforcing the vaccine mandate on any additional sectors than what you've already announced?
At this stage, we've announced, what our plan is, and we'll continue to take advice from the Public Health Unit and the Chief Health Officer on what else we need to do. But what we have done is made sure that we are tackling those really high-risk areas and those areas that we know, like schools, where children, primary school children especially, are not even eligible to get vaccinated yet. We know that it's going to be important to protect our teachers when school goes back.
Do you think there'll be a time, Minister, moving forward that will, I guess, take a leaf out of New South Wales' talking, not doing these press conferences anymore, not updating the numbers? Do you think that when
I don't know, will you let us?
Well, yeah, we're going to need something, but will there be a time, do you think, that we will take that?
Oh, we will absolutely get to a point in Australia that COVID is just another infectious disease that we're managing, that everyone's going off and getting their boosters like we get our flu shots, and we are managing it in our community. But we're just at the start of opening up. We will have cases. We will have many cases every day. I would love that I can stand up and go, well, yeah, we've got 100 cases today, but none of them are needing hospitalisation. That is my wish, that we can simply put out no hospitalisation, no ICU. But that comes down to our vaccination rates.
We did concede that it was coming, and Dr. Aitken and Dr. Yvette Young said the same thing. It is coming. I think, is it safe to say that goes a long way to suggest that next week we're just going to keep going as we were in terms of that roadmap?
Oh, look, as the Premier said yesterday, at this stage there is no change to our roadmap. We do have to open at some point. We have to learn to live with this. What we want is our vaccination rates to be as high as possible.
But just in saying that, does that then seem a little bit, not silly, I don't want to say the word silly, but seem a little bit over proportionate in shutting Adelaide out now, considering it's probably only going to be till Wednesday? No,
because what will happen is whenever we open the borders, the people from Greater Adelaide won't have to quarantine, but they'll still have to be fully vaccinated and they will still have to have a negative PCR test, and that's the difference. Because they're coming from a hotspot, there is greater restrictions. Why? So we can try to slow that transmission.
Commissioner, you were racing out earlier, you were dying to get up here. Just on,
not really.
Look, and I don't want to keep harping on about it, but it's important when we get to I thought Wednesday, it's probably not going to be Wednesday, but let's say it is Wednesday, for argument's sake. We've touched on it before. What's going to be the process with the vehicles? Because the Minister just touched on how many people are going to be coming through. Is there a system, a lane system that you've thought about? Or is that how it's going to work?
Thank you. Can I touch on a couple of things before that, though? Adelaide is going to be declared a hotspot from 1 o'clock in the morning. There are considerable people that come from Greater Adelaide, 600 to 700 people a day throughout 4 airports. Each of those flights will be met, and it will be treated as it is now, like all of the other hotspots. So if you're coming from Adelaide, please know you have to get online, get your border pass, you will be met at the airport, and obviously home quarantine or hotel quarantine. The planning for the borders is quite extensive. In each area they enter, there may be a different response because, as you know, some will be on the highway, some will be, closer in smaller roadways. So each of those areas has an extensive plan built into it. Can I say, and you have to be patient, there will be hold-ups. There has to be. We're talking about significant people that we know will come into the state. We are looking at the border systems better highlighted, on the screen of your vehicle, sometimes 100% intercepts, sometimes random intercepts. But this is an end-to-end compliance system from when you get your border pass, from when you get your test, from when you come into the state. It's end-to-end, and that almost makes it in many ways quite foolproof. I always go back to the part, though, wherever we have seen someone inadvertently get through or doing the wrong thing, they're actually more often than not reported to the police. So please, I ask that you do the right thing, that you work with us. Expect delays, definitely expect delays. We are going to be as thorough as possible, but we expect the public to respect this process and to do the right thing.
It's going to be, I guess, for your officers, it's probably going to be the busiest they've been throughout this 2-year period of COVID.
For my officers, it'll definitely be the busiest period, and that's not only with obviously the borders. The 17th, it is law that if you don't have a double jab, you can't enter pubs, clubs and all of those other areas. So definitely busy, prepared. We've been planning for a number of weeks. We know it's coming, so it's given us that period to plan. I ask again that people be patient, they do the right thing. This is in place for very, very good reasons. So please do the right thing, work with us. And I know it'll be incredibly busy for all of us and for you guys as well. But the next few months we will get through this.
Dr. Aitken, sorry. I've got the Minister is trying to hide the back there.
Did you want the Minister instead?
Plenty of cameras here.
Just on touching on this Omicron again, this case, I guess for you, Doc, how, not worrying, but will you be interested to see, do some research on the case at least and see the potential of it getting out?
Look, I think everyone's interested in doing something on this. It's unusual, it's not Delta, it's not Omicron, it's got characteristics of Omicron. Our people from Forensic and Scientific Services have looked at this extensively. They've spent the night talking to counterparts internationally, and the international committee that actually assigns the designation and the lineage has got all the details on this, and they're working through it. They're not sure what it is either. There's a number of theories. It may be an intermediary step towards the evolution and development of Omicron, but we don't know enough about it. There are genetic changes that mean it may or may not behave like Omicron, it may behave differently. The most important thing is that they're not in the community. They've been in a hotel, now they're in hospital, and they're not exposed to the community, and that's great.
Is there potential that it's a new variant?
Look, we don't know yet. It's too early to say. The most likely thing is part of the development of Omicron and just something that's popped up. There are sort of examples that are potentially similar internationally and in South Africa, and we're working through that with the international experts.
Have you spoken to Dr. Kerry Chan about this and some of the things that New South Wales is experiencing, or I guess the doctor's attitude towards Omicron?
Look, I think we meet with HPBC at the moment, and Dr. Chan's part of that every day, and there's a meeting at 11:30 this morning, and we talk about these. I'll brief them on this genomics result, and we're watching with interest how things evolve in New South Wales and Victoria, because they are that path further ahead than us, and they've been through the suppression phase already. And South Australia is the one we're talking to very regularly and just watching what happens there as they open up, and very willing and very happy to learn from their experiences. Thank you. I was going to pass over to Minister Ryan with that one.
A group of US and British scientists have found a trigger for the extremely rare blood clots from the AstraZeneca vaccine. Do you think this will help ease the potential hesitancy to get that one?
Look, I haven't seen the details on that, but I think anything that helps us understand what the triggers are, that we can identify the people that are at risk and avoid them having AstraZeneca, that's great news.
Okay.
Okay, thank you.
Thanks very much, Minister and Chief Health Officer. And hello to all the Queenslanders who are tuning in, particularly those Queenslanders who are tuning in from the southwest and are impacted by floods at the moment. Can I just say this, the locals there have been absolutely outstanding when it comes to responding to this flood risk and the flood impact. Not only have we seen citizens doing the right thing, but also the local council has delivered significant and outstanding leadership, and also emergency services have been just brilliant. We've had SES personnel, as well as also members of our rural fire service and fire and rescue service deployed into those areas and assisting people, helping people, protecting the community. So I just wanted to say that it's tough out there when you have floodwaters coming through your community, but the community has done the right thing, they've stepped up and they've done an outstanding job. We'll get some updates in a moment from Commissioner Leach and Commissioner Carroll about the situation on the ground. The weather conditions for the moment have eased. So what we're seeing through that southwestern area is the surge of floodwaters moving through communities. We will see the peak in Gundawindi probably later this morning. It will be slightly lower than what we were predicting, but nonetheless it is still a major flood. So enough significant planning has been done to ensure that we minimise the impact wherever possible on that community. There's been a number of evacuations from the aged care facility and the hospital, and citizens are listening to the council around the important messages that they need to hear around being ready for the flood impact and the peak. We have also pre-deployed a number of SES and fire and rescue, swift water rescue assets and resources into that community. Over the last 24 hours, we've had 57 requests for assistance from the SES, almost half of those in Gundawindi, and they relate obviously to flood preparedness and preparation. We also have completed over 300 damage assessments in those communities that have already been impacted by the peak of major flooding. So they're communities mostly in Inglewood and Texas, and Commissioner Leach will provide some updates around that. We've also undertaken support to assist communities with resupply of food and medical supplies, and that's mostly in the Inglewood and Tara communities. There is still a key message for people though. The catchments and the ground, and I know this is stating the obvious, the catchments and the ground are still heavily impacted by moisture and are water sodden. That means that if we do have a downpour of rain over the next couple of days or the next week, the risk of flash flooding is actually enhanced. So the messages around not entering floodwaters and being prepared around the impact of flash flooding is probably now more important than ever, because the impact, because of the current conditions, could be significant for citizens, their family and friends. So important to reinforce those messages around if it's flooded, forget it. This week we have seen too many people unfortunately and sadly impacted by the tragedy of being caught in floodwaters. So the message is always prioritise your safety, stay away from floodwaters. I'll now invite Commissioner Leach firstly to provide an update from a fire and emergency services perspective, followed by Commissioner Carroll.
Thanks, Minister. Good morning, everyone. The response to the flood event in southern Queensland continues. For us today, the townships of focus are Gundawindi, Yellowbourne, Dalby, Warwick, Chinchilla, Taroom and Cecil Plains. So as you can see, this is a widespread event. We've got peak river levels in a number of locations, and this water is relatively slow moving. So it will take several days for it to move through the catchments, and towns will progressively come under threat over the coming days and week. We have over 90 QFES personnel ready to be deployed across that area as required. We also have 3 aircraft, 3 helicopters available, so we can move people and equipment into affected locations quickly. We can also use those aircraft to drop supplies to people who might be isolated by the floodwaters. So we've also conducted 352 assessments on buildings within Inglewood and Texas, and the results of that assessment is that we've got 2 properties that have been assessed as severe. That's down from 3 properties that were mentioned yesterday. On re-inspecting one of those properties, it was deemed that it was uninhabitable prior to the floods anyway. So 2 properties that were habitable prior to the floods that are now severely damaged as a result of the floods. We've got 15 properties assessed as moderate damage and 105 properties with minor damage. All of the washouts of affected properties in Inglewood concluded yesterday, and residents can get on with the work of cleaning up and starting to recover from this event. We've also had State Emergency Service conducted a number of tasks in Goondiwindi overnight, but they also conducted 10 tasks in Banana over the last 24 hours. So that just shows how widespread this flood event is. And we're not over it as yet, because if we get more rain next week, which is forecast by the Bureau, there is the chance that these catchments will come up again. And in the last 24 hours, we've conducted no swift water rescues. So that's very pleasing that people have heeded the message about not driving through floodwaters. So thank you to all Queenslanders for heeding that message. And just a reminder that if it is flooded, forget it, back it up and find another route. Thank you.
Thanks, guys. I probably don't have too much more to add, because I think that the Minister and the Commissioner have adequately addressed most of the issues. I just did want to reiterate the message that we don't think that Goondiwindi will hit the peak as it has done in previous years, even in 10-11 when it was 10.64, and we were predicting 10.7, and we believe that that won't be the case in this instance. It is slow moving. We were expecting the peak over the last 24 hours, and we're expecting that this morning. 3 residents voluntarily evacuated to Toowoomba from aged care, and we also did move 3 acute patients from the hospital to Warwick. Other residents still remain, and they are very, very safe. A lot of planning went into those vulnerable people over the last few days. And obviously they do have the showground, which is higher ground, and a lot of people can evacuate to that. I did want to comment on the excellent planning in that part of the world. They've really been on top of their game at every level, be it at the local level and the district level, and certainly with the support of all the agencies, QFES, QPS and the ADF, the response to date has been second to none. As was alluded to, we still obviously have a few days that we've really got to keep a close eye on, but certainly I'm extraordinarily pleased in how the response is going to date. And I do have to mention what the Minister and Greg has said. Please, if it's flooded, just forget it. You know, the tragedies that we have seen are people going into flooded waters unnecessarily and lost their lives. But not only that, you are putting emergency services' lives at risk as well. So think about yourself, think about your family, think about those emergency services that need to come in to help you. Incredibly, incredibly important message. If it's flooded, forget it. Thank you. We won't open up for any other questions. Oh my God. Take care, guys. Have a lovely day.